Welcome to Advanced Home Care's OASIS Video Tip of the Month for October 2011.
So, Jenny, how are you doing now that you're home?
I'm doing pretty good. Yeah, I've only been home for one day. Just came home yesterday.
Okay. And you're doing all right? Any?
Don't touch me.
Don't touch. Okay. I'll move back a little bit.
Okay.
So I take it that leg is bothering you.
It hurts. I can't sleep, and it just hurts. Burning.
Well, my name is Joy, and I'm a physical therapist.
Okay.
And I think you probably had some therapy in the hospital.
They made me walk.
Yeah, right. How'd that go?
It didn't go well.
Didn't go well.
I don't like them.
Well, I guess maybe that's why I'm here. So the first thing I'd like to do is just take a look at your leg, your incision, and make sure everything looks great with your incision.
Take it off?
Well, yeah, not your leg. We were just going to take the bandage off so we could look at that incision where they did that graft.
Can you just peek down in there?
Well, I could, but I don't really see a whole lot when I peek.
Okay.
I was just wondering if I could just unwrap it,
Okay.
and I'll be glad to rewrap it.
Okay. All right.
And
Good.
I won't,
good.
we'll keep it covered while you're doing your walking.
Okay. All right.
Okay. Let me I have to make sure I wash my hands, of course. So let me just give a little squirt here. Would you like a squirt?
No, does it stink?
Okay. Does this? I don't. No. This
Okay.
just smells like soap.
Oh. Okay.
Yeah. Antimicrobial stuff. Yeah. Okay. So we'll just get that on.
I read somewhere you're supposed to rub it until it's dry.
Yeah. Okay.
People rubbing.
I'm trying maybe and sing happy birthday or do any of those good hand washing tricks. Yeah. Okay. What do you think?
That looks better.
Still kind of shiny, aren't they?
You used a lot.
You're supposed to use a whole tablespoon. Yeah, maybe I have small hands. All right, well, let's see if I can get those gloves on, and let's take a look and see what's going on with that fiery leg.
Be so careful, it hurts.
It hurts. I'm surprised, did you get any sleep last night? In that much pain?
No.
Yeah, that's tough. That usually makes me kind of cranky.
You think I'm cranky?
No, but I mean, I think you're doing quite well. I'm usually pretty
oh.
cranky after I miss a good night's sleep.
We have a new bandage. This one's loose.
Yeah, I think I see some right over there on your shelf.
Okay.
I think maybe, did you come home with those from the hospital?
Yes, I did.
Yeah, so I think between what you got and what you have over there, we'll be able to hook you back up. Let me just get rid of this tape here. All right, here we go. You okay? All right, you let me know if you have any trouble.
I'm holding my breath.
Don't hold your breath. Nice
Okay.
deep breaths. Nice deep breaths. Are you
Lord.
okay to look at it? Yeah. Ooh, look. Yeah, we have a little. Is that okay? Got a little drainage there. It looks like on the.
Like it's bleeding.
Well, yeah, it's red, but red is always good. Yeah, it looks like you have a pretty good incision there, don't you?
Yeah.
Yeah. Kind of, and it looks kind of red and draining. I think. No wonder that's on fire. It hurts. Yeah. I think maybe what I'm going to do is give the doctor a call and see if we can have a nurse come and take a look at that and maybe teach you how to do some regular dressing changes to that leg.
Okay.
Does that sound okay?
Yeah, that sounds good.
Okay. Well, let's
Be
get that.
careful with that.
Yeah. Let's get that baby wrapped up and get to work.
Okay.
All right.
All right.
OASIS question M1340 asks, does this patient have a surgical wound? Answer options include 0, no, 1, yes, the patient has at least one observable surgical wound, or 2, the surgical wound is known but not observable due to non-removable dressings. In our video, the patient does have a surgical wound. The patient's resistance to a wound dressing change does not make the wound unobservable. The only reason a wound would be considered not observable is due to an MD order not allowing us to remove the dressing at the time of the OASIS. The wound should always be assessed unless there is an MD order otherwise. OASIS question M1342 concerns the status of most problematic observable surgical wound. Possible answers to this OASIS question are 0, newly epithelialized, 1. Fully granulating, 2. Early or partial granulation, or 3. Not healing. 0. Newly epithelialized would be used for wounds that are primarily healing with no incisional separation. Epithelialization is regeneration of the epidermis across a wound surface. 1. Fully granulating would be used only if there is incisional separation. 2. Early or partial granulation would be used only if there is incisional separation. 3. Not healing would be used if the wound is healing entirely by primary intention with the scab adhering to underlying tissue, the site is held open by a line or needle, or if there is incisional separation with no granulation tissue. In our video, the most problematic surgical wound is on the leg. It would be considered not healing because there are signs of infection. A score of 2 or 3 on this item would result in additional clinical case mix points. And since the wound in the video appeared to be infected, the therapist in the video would ask nursing to make a visit to assess wound status. Some tips. For the purpose of M1340, does this patient have a surgical wound? Remember, orthopedic pin sites, central line sites, stapled or sutured incisions, and wounds with drains are all considered surgical wounds. If the patient has both an observable and an unobservable wound, the best response is 1, yes, the patient has at least one observable surgical wound. For the purpose of M1342, status of most problematic observable surgical wound, select response 0, newly epithelialized, for implanted venous access devices and infusion devices when the insertion site is healed. Surgical incisions healing by primary intention have approximated wound edges with no visible wound bed and do not granulate. Therefore, the only appropriate responses would be 0, newly epithelialized, or 3, not healing. If the wound is healing solely by primary intention, observe if the incision line has re-epithelialized. If there is not full epithelial resurfacing, such as in the case of a scab adhering to the underlying tissue, the correct response would be 3, not healing. Some common pitfalls. Ostomies are not considered surgical wounds. A pressure ulcer does not become a surgical wound by applying a skin graft or through surgical debridement. The skin graft donor site is considered a surgical wound, and the presence of sutures does not automatically mean you have a surgical wound. Thank you for watching the OASIS Video Tip of the Month for October 2011. Advanced Home Care. Home care is our business, caring is our specialty.